Hi, I'm David with Response CPR. I've been a paramedic for over 15 years. I'm also an EMT instructor and a CPR instructor as well. Today, what we're going to go over is your medical assessment at the EMT level utilizing the National Registry Guidelines. This is the year 2025. Let's dive into it. BSI, is my scene safe? My scene is safe. I want to determine the mechanism of injury or the nature of illness. I want to determine how many patients I have. I also want to request additional resources and consider stabilization of the cervical spine. At this point in time, I want to get a general impression. What is it that I'm seeing as I approach my patient? So, what's my general impression? I also want to determine the level of responsiveness my patient has. So is Fred tracking me as I walk in? Is he looking around? Is he alert? Or does he need a verbal stimuli, a painful stimuli? Or maybe he's completely unresponsive. Because he's alert and he's talking, I want to see what is Fred's chief complaint. Why did you call 911? What's going on today? At this point in time, I'm going to do an assessment of the ABCs. Let's start with the airway and breathing. I want to see if the airway is patent, if it's open. I also want to assess the ventilation to make sure that it's adequate. Maybe Fred is having shortness of breath, labored breathing, fast breathing, or tachypnic. I want to also determine if Fred needs oxygen therapy. Prior to administering any oxygen, I want to get a baseline SpO2 because that is going to be my starting point. I also want to go into my circulation. So I'm going to grab a radial pulse. I'm going to note the rate, the rhythm, and the quality. At the same time, I want to assess the skin color, temp, and condition. I also want to assess for any major bleeding. At this point in time, we don't have major bleeding. Based off of the information that I'm receiving, I'm going to make a transport decision. Fred, I believe we should go to the emergency room so you could see an ER physician, okay? Fred says okay, so we're going to get going. At this point in time, I want to get a full set of vitals. This includes a blood pressure, a pulse rate, a respiratory rate, SpO2, and a temperature. And I want to get into my OPQRST so that I could start my investigative work on what's going on with Fred. So O is onset. I want to know if this was a sudden onset or did it take some time to fully come on. I want to know P, provocations. So was this something that gets better or worse with certain things that you do? I also want to know the quality. Fred, can you describe what your pain feels like? I also want to know if it's radiating anywhere. Fred, does your pain travel anywhere else? Does it go into your left arm? Does it go into your jaw area? I also want to know the severity. On a scale of 1 to 10, 1 being a little bit of pain, 10 being the worst pain you ever felt in your life, how would you rate your pain right now? What number would you give it? And then time. I want to note the time that it actually started or completely got worse. I also want to dive into my signs and symptoms. So, signs are things that I can see. So, as I was checking his skin color, temp, and condition, I saw that he had pale, cool, and diaphoretic skin. So, these are things that I'm seeing. I also want to note his symptoms. So, things that he's experiencing, that he's feeling. I'm going to ask Fred if he has any allergies. Do you have any allergies, Fred? I'm also going to ask him about medications. What medications do you take on a daily basis? I also want to know any past pertinent medical history, things that maybe have to do with his heart, right? So we're talking about high blood pressure, high cholesterol, previous heart attacks, any blood clot history, things of that nature, because it correlates to what's going on today. And then I also want to know when's the last time he ate something? And then events leading up to what happened. Was Fred sitting down? Was he outside mowing the lawn? This is going to give me a ton of information. At this point in time, with what I received, I believe that we're dealing with a cardiovascular system. So I'm going to go in and ask more deeper questions. I'm going to ask if there's any pain when I push. I'm also going to ask if whenever Fred takes a deep breath, if that changes his pain, that makes it worse. I also want to get another set of vital signs. This is going to include a blood pressure, pulse rate, respiratory rate, SpO2, blood glucose as needed, and also I'm going to check his eyes to see if they're reactive to light. At this point in time, I'm going to state a field impression. I believe that Fred is having an MI. I'm going to go through my interventions. So Fred is on oxygen. We have him on 3 liters per minute via nasal cannula. I'm also going to consider aspirin, 324 milligrams PO. And I'm also going to consider nitroglycerin, 0.4 milligrams sublingually. At this point in time, I'm going to name and state my 9 rights. I want to make sure that I have the right patient, the right medication, the right dose, the right route, the right time, the right education, the right response to that medication, the right to refuse, and also the right documentation. I'm going to reassess Fred every 3 to 5 minutes to see if the medication that I'm giving him is working, and then I'm going to call the emergency room. This completes your medical assessment at the EMT level for National Registry. And there you have it. So that's going through the medical assessment. If this helped you, please share it. Click the like button and subscribe. We're going to be putting out more content on EMT skills and also CPR instruction. If you're in Southwest Florida, we are holding classes for adults and kids 10 to 16 with our responders camp. We hope to see you soon. Hey guys, I want to give you 3 tips on helping you to complete your medical assessment. The first tip is make sure that you're reading your textbook so that you can understand certain diseases. This is what's going to help you as you're being presented with information on your medical assessment. The second tip is go ahead and write out your medical assessment every day. Take 15 minutes, turn over your medical sheet, and then write out each line. This is going to help you to memorize where you're at and what needs to be done. The third tip is make sure that you're verbalizing everything as you practice your assessment. We hope that this helps. We'll see you soon.